Good day. I welcome you to the Global Health Discussion Forum. As you'll note on this slide, these forums are produced by collaboration between the Hospital for Sick Children and its global program, SickKids International, and the Peter Silverman Center for International Health at Mount Sinai, and the Global Health Office of the Dalai Lama School of Public Health at the University of Toronto. My name is Alvin Zipursky, and I'm the Chair and Scientific Director of the Program for Global Pediatric Research. This is within SickKids International here at the Hospital for Sick Children. As I mentioned in the original invitation, which many of you received, we're really very pleased within our program to be hosting our speaker today, Dr. Bhutta. Now let me tell you a bit about Dr. Bhutta. And actually I'll have to keep it to a bit because I could go on all day. Professor Bhutta officially is the Hussein Laji Diraj Professor and Founding Chair, Division of Women and Child Health at the Aga Khan University in Pakistan. In the invitation you received, we briefly described his work and his honors. There are many such honors from the Aga Khan University, from the government of Pakistan, and internationally there's been recognition and awards. Clearly, in my opinion and the opinion of many, Dr. Bhutta is undoubtedly a major leader in global child health, and as he wishes to emphasize in maternal child health. I say emphasize because he is a director of a Department of Maternal Child Health. I shall not list, as I mentioned, all of his awards or all of the international committees that he has participated in and led. Undoubtedly, some of you have read about him via Google, and those who have not, I strongly suggest that you do. One need only read his many articles in The Lancet to realize the extent of his influence worldwide. I've known Dr. Bhutta for several years as my dear friend, and during which he has been a major advisor to our program for global pediatric research. During that time, I've been able to follow not only his guidance, but also his work. And to me, what's been very impressive is his ability to develop high-quality clinical programs and at the same time develop critical, significant research. I can only emphasize the importance of his research on problems in a developing country done by researchers in that developing country with important implications in child health programs, again, in that country and now in other countries around the world. To me, it's a prime example of how problems in developing countries are to be identified and solved by those working in their country. Indeed, I recall that when I had the opportunity to introduce him for the PGPR Award for his outstanding contributions in global child health, I read a statement made by one of those supporting his nominations, and it read, "He is a tireless adherent to building an evidence-based science of public health, and he has established the capacity to do this in the developing world." Dr. Bhutta is here at SickKids to lead a program focused on the major childhood health problems of diarrhea, a killer of more than 1 million children a year. He is using his clinical and research experience in that field to lead an international initiative to develop a global action plan to eradicate childhood diarrhea. It's appropriate, therefore, today that Dr. Bhutta will speak to us about challenges in maternal and child health, and is characteristic of all of his work. He asks the question, how can we contribute? Dr. Bhutta.